Okay, we're going to be talking about astigmatism. I get that question so many times. What is astigmatism? So if we draw the eye itself, here's the cornea, if my pen would work. Okay. Here's the iris, ciliary body, iris, ciliary body, and then we're going to be drawing in a cataract here, or a lens when it becomes opacified. Astigmatism, this cornea, if I could draw better, should be a perfect sphere, right? Kind of like a basketball. If someone's cornea is like a basketball, it has no astigmatism. Okay, so perfectly round. But astigmatism is when the cornea, rather than being perfectly round, is slightly ovoid, or looks kind of like a football rather than a basketball. Okay, so if you have an eye here, right? Astigmatism inside the cornea, it can be steeper in this meridian, or it can be steeper in the other meridian, and that ovalness of the cornea causes the images to be stretched out, which causes blur. So that's why people with a lot of astigmatism have to either have contact lenses or glasses to eliminate that astigmatism. Now, astigmatism can be in 3 places as well. Often I'm doing cataract surgery and the patient says, well, I've got astigmatism, aren't you going to correct it? Well, astigmatism can be in the cornea, it can be in the lens, or it can be in the retina, very rarely. The 2 major ones are lenticular astigmatism, or astigmatism that's inside the lens, or in the cornea. But when I take out your cataract, the astigmatism that's in the lens is now negated. So all I need to worry about is the astigmatism that is inside the cornea. So as a general rule, if you have 0.5 diopters of astigmatism or less, we keep it. A little bit of astigmatism provides depth of focus. So if you have 0.51 or greater, okay, all the way up to maybe 1.25 to 1.50, that's what we call mild astigmatism, and that can be treated with what are called limbal relaxing incisions. So if your cornea is steepest in this meridian, what I can do is take a diamond knife and make a precision semi-thickness cut in the cornea. And that allows the cornea to relax and assume a more circular form and give you better vision. Now, if you have astigmatism that's, say, 1.25 or greater, that's moderate astigmatism all the way up to severe. And if it's regular astigmatism, we can correct that with an intraocular lens, such as a toric lens. It has little marks that you align that. So some people ask me, well, how do you know what to use to correct my astigmatism? Well, if it's 0.5 or less, we're not going to do anything. We're going to leave it alone. If it's 0.51 up to 1.25 to 1.5, depending on in what angle it is, we're going to use limbal relaxing incisions. And we're going to allow your cornea to relax into a more round form. If it's 1.25 to 1.5 and greater, and it's regular astigmatism, we're going to use a toric lens, or we can use a toric lens and an LRI, so that we can help reduce your astigmatism and give you clearer vision.